the shift change to take over Mr. Jenkins. Is there anything that I need to know that would be important for his care?
Yes. Alan's 72. He came in with a stage 3 decubitus ulcer on his buttocks. He has diabetes type 2 and his sugars have been running over 350 for the last week. He does have a temperature 101.6 last time I checked. His heart rate 110, respiratory rate 16, and blood pressure was 150 over 80, and then saturation of 94%.
Okay.
We'll need to do dressing changes on him. His wife and children are here and they want to know how to take care of that and treat that ulcer. He's taking 1,000 mg of metformin by mouth daily and Lovanex 400 mg subcutaneously daily. Top 3 nursing diagnosis was risk for infection related to his ulcer. He's at risk for impaired wound healing related to his type 2 diabetes, and he's at risk for situational low esteem related to the location of his pressure wound. He was saying that he knows he's not been eating as well as he should be. He said, I have had trouble making it in time to the bathroom nowadays, and he feels embarrassed that his family's having to take care of him. And then some, what else? Our goals for this patient are that him and his family will identify interventions to reduce his wound infections by proper wound management by the end of the shift. We're hoping that his glucose level will decrease to 250 within the next 24 hours. We'd like his family members that are with him to demonstrate an understanding of ways to improve his self-esteem by protecting his dignity by the end of the shift. I thought that taking measures to prevent infection in the patient's wound was most important in order to promote proper wound healing, safety, and patient health. Chose to focus on his blood sugars to prevent future pressure ulcers and to help heal and prevent further breakdown on his current pressure ulcer. And then I chose to focus on the patient's self-esteem last because it's not an immediate concern for us right now, but it is important that we address it.
Okay, sounds good. So I'll go ahead and go in there and assess the patient. Thank you for your handoff. Knock, knock, knock. Hi, Mr. Jenkins. Hi, my name is Allison Smith, and you're going to be your nurse today. I'm taking over for Lauren. Can you go ahead and state your name and date of birth for me, please?
Alan Jenkins, I'm 72.
Okay, so I'm going to make sure your brakes are locked. That is what I verified on your bracelet. Today I'm going to start off with taking your vitals, if that's okay.
I guess.
Okay, so I'm going to start off with your temperature first. Go ahead and have you stick this under your tongue. Okay, we got a reading of 101.6. It's a little high. I have a bit of a fever. Next, I'm going to come over here and I'm going to take your blood pressure. So I'm going to have you roll back over. And I'll sit you up a little bit. Want this color? Oh, I see you got some candy here.
No, I don't.
Yeah, probably. Shouldn't be having the candy in your bed. Okay, I'll go ahead and keep taking your blood pressure. Go ahead and pull this up a little bit. That's okay. I'll have you sit your arm like this for me. Do you know what your blood pressure normally runs?
No.
Okay, sounds good. Okay, it was about 150 over 80, so it's a little bit high, but not too bad. Next, I'll go ahead and do your radial pulse. I'll have you go ahead and give me your arm. Okay, it was about 110 beats per minute, and there was about 21 respirations. I'm going to go ahead and get your O2 sat. Like to stick it on your finger, measure your O2 sat. It was about 98%. So next, I was sitting here to kind of explain to you treatment for your pressure ulcer on your bottom. So we decided as a group in the nursing group, we said that for treatment of pressure ulcers, you're going to want to implement proper turning. So turning every 2 hours promotes proper circulation and relief of the pressure on that bony prominence. So for you, it would be on your buttock area. Proper nutrition and fluid intake. So proper nutrition and fluid intake, they lead to better nourishment, which encourages wound healing. Next, we would do your blood glucose level. So you have been running a little high over the past week. So it's been about 350. Monitoring that blood sugar will help reduce the risk of your pressure ulcer injury worsening. And then your last thing would be to your medication use. So making sure that you're taking your diabetic medication when you're supposed to and as instructed. Next, we were going to talk about reasons why that you may have developed this pressure ulcer. So like I said a second ago, your glucose levels, they have been elevated. So maybe if we try to get those down, that will help with some wound healing. And then you may have been laying on your back too much, which for long periods of time can reduce the amount of circulation and also puts a lot of pressure on the area. So does that make sense?
Yeah.
Okay, do you guys have any questions?
I don't think so.
Okay,
Thank you.
and so now we'll talk about some risk factors. Some risk factors for pressure ulcers are being an older adult, people who are immobile from injuries such as if you're paralyzed or say you broke your leg and you're not able to walk, if you are placed in a long-term care facility, hospice, you're on hospice, you are in a community care center or you're like an ICU patient. Also, people who are acutely ill have a higher risk of developing a pressure ulcer. Individuals with diabetes, impaired sensory perception, so like in your feet, you do not have one on your foot now, but since you do have some sensory issues or could develop some sensory diabetes, that could also be a problem. Alteration of your level of consciousness, shear or friction to that area, moisture or incontinence, and poor nutrition. So as we have assessed you today, we have decided that some of the risk factors that put you at risk for ulcers are that you are 72. But prior to being here at the hospital to treat this pressure ulcer, you were in a long-term care home. You do have type 2 diabetes. You have had some problem with incontinence, which created moisture to that area. And you do have some poor nutrition with your diabetes. It's like I can see this candy here, so we may want to try to take some of that sugar intake down as well and some of those carbs.
Mr. Jenkins, I'm Stephanie. I'm a Cal State nursing student.
Hi, I'm Lauren. Who do you have with you today?
I'm his wife. I'm his daughter.
Nice to meet you.
Check the brakes. Would you mind go ahead and stating your name and date of birth for us, please?
Alan Jenkins, 72.
Okay, very good. That's what we have.
So today we're just gonna kind of show you guys how to take care of Alan at home with his pressure ulcer. And if you have any questions as we go, feel free to ask. Alright, so we're just gonna uncover the wound part, keep you as covered as we can. First, we'll just take off the bandage.
And then we'll remove the gauze.
And then we would irrigate it with normal saline until it runs clear. So just all throughout the wound bed.
Okay, and then you would want to go ahead and have him shower and dry off the wound, and then we would repack it.
And then repack it with packing strips. And make sure to just pack it to the surface, not over, and make sure to not pack it too tight.
Okay, once you have that packed, then you're gonna cover the wound and tape it. Okay, and then you want to make sure that you are assessing the wound daily, looking for any signs of infection, which might appear as redness, might be warm to the touch, or you might see exudate or swelling around the area. Do you have any questions?
Any questions?
Are we gonna be doing this ourselves, or is there someone that we can call for help if we need it?
Yeah, we can definitely get you guys in touch with some community resources. We'll have somebody come in and go over that with you.
Okay, perfect.
Okay, all right. Anything else, Mr. Jenkins?
No, I'm good.
Okay, your call button's here if you need anything.
Thank you.
Okay.
Knock, knock, knock. Hi guys. So I'm here with a social worker, and she's here to explain some different services that can help you at home to heal the wound that you have. So here's Ariana, and I'll let her go ahead and explain.
So hi, my name's Ariana. I'm your social worker. I just have a few resources for you. The first one is called Serenity Home. They offer wound care, so they'll be doing all the dressing in case you're not comfortable with it. They also will assess the wound to make sure that it's healing properly. And then the second option I have, in case you don't like them or they don't work with their schedule, is Providence Home and Health Hospice. They also would send a nurse to your home and perform wound care as well.
So Alan, do you have any questions?
I don't have any. Do you guys have any? Are there any additional services with that? Like therapy maybe? I just am worried. I don't want him to just be immobile all day. I'd like him to have some kind of movement.
Yeah, so actually Providence, they do offer physical therapy, so they can talk to you and come up with a plan and just exercises that you can do at home to make sure you're having proper blood circulation. So, yeah.
So is that,
I also heard that you're having a problem with your diabetes.
No, I'm okay.
No?
My blood sugars are a little high, but I don't think it's a problem.
Okay, well, Providence also offers diabetic management. They can help you control your blood glucose, they offer you tips, and they can also come up with a diet plan to help you. Hi.
hello.
So, my name's Alice. I'm a social worker here to check up on you. How you been?
I'm good. I got my puzzle.
Oh, what are you working on?
It's a frog.
It's a frog. Do you like frogs?
I do like frogs.
That's good, Al. Let's check up on you. How's your blood glucose levels? How's your blood sugar?
It's a little bit better. It's been around 300 lately.
300, okay. And that's an improvement. We do want to get that down to 250. What do you regularly eat in a day?
I like a lot of pasta.
Pasta?
Yeah.
Does your wife cook that for you?
Yeah.
Yeah. Is your wife home a lot to cook for you?
Usually.
Usually?
Yeah.
Okay. So I brought you a sample meal on what healthier items you can eat.
Okay.
So this has less carbs and less sugars, and it's just a healthy meal.
Okay.
And it's just as tasty as pasta.
It looks good.
Have you been cutting down on your sugars? I know you love candy.
No, I do love my candy. I've been trying though.
Yeah?
Yeah.
Okay, I also bought an alternative to that.
Okay.
So instead of candy, we're gonna try yogurt.
Okay.
It's just as sweet. And just let me know if you like it.
Okay.
If you don't, I can get you other flavors or I can look for another snack for you.
Okay, perfect.
Okay.